Welcome to Lupus South Africa and Andrea's Gift Foundation's 4-part series of the most asked about topics in support of Lupus Awareness Month, as you know. So the first topic we are going to talk about is lupus in men. There's a lot to cover, so let's jump right into it. Let's start off with a few facts. Systemic lupus erythematosus, which is SLE or lupus for short, is about 10 times more common in women than it is in men. There are actually very few diseases in which the difference between the two sexes are so great. Lupus in men looks much different than lupus in women. So why is lupus so much more common in women than it is in men? So to put it into a nutshell, no one knows exactly why this is the case, but scientists have come down to a list of things that suggest why. So men and women have different sex chromosomes, and so differences in genes on these chromosomes may be important. Men and women also have different sex hormones, and this probably plays a role in the development of lupus. The evidence suggests that hormones can exert an important influence on the immune system, and in particular, that the female hormone estrogen can affect the development of lupus. Some studies have suggested that levels of male hormones, called androgens, are reduced in men with lupus, but these observations have not been supported in the majority of studies. However, there is a difference in the way that the androgens are metabolized, which means processed, between the genders. There is no evidence that any form of hormonal treatment would help men with lupus. So let's look at a question that probably comes up the most. Is lupus in men different from lupus in women? Comparing the clinical features of lupus in men and women is difficult because most clinics have very few male lupus patients to study. However, over the last 30 years, there have been a number of reports from different countries that have made this comparison between genders. Different results were reported by different groups, but overall there is no strong evidence that lupus is either more severe or less severe in men compared to women. The most consistent findings between the different studies were that men with lupus were less likely to suffer from, number 1, Raynaud's phenomenon, which is fingers changing color from white to blue to red in cold weather, or photosensitivity, which is lupus rash worsened by sunlight. Number 3, alopecia, which is baldness, is more likely to be noticed as abnormal by women than in men. Number 4, a number of studies show that men were more likely to develop kidney disease than women. Number 5, overall men have a greater risk of developing heart attacks and strokes compared to women. Other symptoms of lupus in men would include a rash on the cheeks and nose, shaped like a butterfly, chest pain with deep breaths, extreme fatigue, hair loss, joint pain, mouth or nose sores, and swelling around the eyes or in hands, feet, and joints. So let's move on to the next question. Are treatments and side effects of treatment different in men with lupus than in women? So the same drug can be used in patients of either gender, and side effects are mostly the same. So let's look at other struggles men face with lupus. Men with lupus, as far as sex hormones and sexual function are concerned, are no different from men without lupus. Men with lupus are usually sexually active, potent, and have normal reproductive histories. Many of the day-to-day stresses in life are equal emotionally for men and women with lupus. However, in some ways it may be more difficult for men to cope with having lupus because of the pressures created by what they think their family, friends, and society expect of them. For example, they may not be able to work or follow certain hobbies in the same environment previously expected of them when they did not have lupus. Example, they are now not able to do anything in the cold due to Raynaud's phenomenon. There may be difficulties in performing activities that require physical strength or prolonged periods of physical labor, and a change of role in the workplace may be desirable but not always available. If a man with lupus has to stop working or change job, this may result in significant financial and emotional stress. However, this is by no means necessary in most men or women with lupus. With earlier diagnosis and better treatment, many patients can remain in work, although some will have to change their jobs, modify duties, or reduce the hours compared with their colleagues. Another aspect of the disease that men and women actually have to cope with is the change in physical appearance. Rashes, unexpected hair loss, or weight gain may not be appreciated as being as important to men as to women. Often men find it difficult to talk about health matters or seek support from self-help groups. What they can do is maybe appreciate one-to-one informal chats more than taking part in a predominantly female meetings. So let's get to the conclusion of this video. Men, just like women, will need to discuss their lupus disease and its effects on their health and lifestyle with their consultant. There is no definite evidence that the disease is more severe in men than in women, or that men with lupus have more female hormones or less male hormones than those without lupus. Fertility is not usually affected, but active disease and certain drugs may affect sexual function, and this needs to be discussed openly by the patient and his physician. Men should, as with women, change lifestyle, because lifestyle changes has proven to lessen flares and symptoms in men with lupus. Regular doctor's visits, taking medication religiously, and constantly having a mental health check is key. Alright guys, thank you so much for listening, and we will see you next week Friday for part 2.